Good morning, everyone. I'm Ravina, Program Coordinator at Seed Autism Services. So today we have two guests, Belinda from Seed Autism Services and Casandra from MyDietitianEats. So we are here to discuss on feeding and the importance of collaboration. Our goal for today is to see the intersection between nutrition and behaviors. We will start with a brief introduction. Let's start with Casandra.
Sure. My name is Casandra Ang. I'm a registered dietitian and the managing director of MyDietitianEats. I have been working as a dietitian for almost over 7 years and mainly focusing on helping individuals as well as families with improvement in terms of nutrition, via a really realistic as well as practical ways. So basically what a dietitian do, we do nutritional assessment, assessing their family history, medical condition, what is their health goal in terms of nutrition, dietary intake, and then later on coming down to the nutritional diagnosis, what are the challenges or maybe obstacles that they face in terms of getting enough nutrients, and then working hand in hand with the individuals or maybe the families in order to come up with the complete intervention plan, and then we do monitoring and evaluation from there. And then over the recent years, many more and more parents or child approaching us, I have developed a strong interest in supporting families or child that has feeding issues, especially those with autism. So we work closely with the family in order to understand what is the struggles behind, and then supporting them in every way possible, trying to get their feeding issues fixed and all.
What about Belinda?
Hi everyone, my name is Belinda. I'm a credentialed program supervisor here at Seed. So what do I do? A little bit of background of myself. I've worked in this field for coming to 9 years now. And we provide early intervention. So the population that we work with are preschoolers and primary school age students. My day-to-day jobs consists of doing behavior and skill assessments, and through this assessment we will identify the learner's strength and areas for support, and using this information I would then create individualized education plan and our behavior intervention plan, which I would then proceed to train the therapists and family members to implement the plans. And on top of that, I also collaborate together with health professionals such as speech therapists, dietitians, OT, and doctors and school teachers to help with our neurodivergent children's development.
All right, thank you so much. So earlier, Casandra mentioned about your interest with neurodivergent population. So my next question is, what inspired the two of you to pursue with this collaboration, and why do you think this is important?
Yeah, I go first?
Yeah, sure.
I was very much inspired to collaborate with Seed Autism Services Center because I think we share the same goal where we wanted to support children with autism in a more holistic way. Because often many children with autism, they have feeding challenges, and often these are not addressed by looking together in terms of behavioral changes or even behavioral needs. That is why we see, by working closely with ABA therapists, we get to understand the reason behind all these feeding issues, feeding challenges, or maybe behavioral needs as a whole. And then from there, we get to offer a more supportive, effective, or maybe more family-oriented kind of intervention to the family.
Yeah. For me, when I look at look back at my working experiences, I find that if I collaborate together with other health professionals and collaborate closely with the family members, it really helps with supporting the children's development. And then in specifically towards diet, when I look at my clients, actually more than half of them do have some form of difficulties with feeding and eating. It could be not able to chew due to oral motor challenges. It could be not willing to try new food. It could be having very restrictive food group. And this is the area that I believe that if we collaborate together, we can provide more holistic care.
I agree with you totally, because sometimes it might be challenging for even us that when we are dealing with the parents and we need to often tell parents, can you check with the therapist about this? Or you might do the other way around, can you check with dietitian about this? So it will be better if we just straight away collaborate together.
Right from the beginning,
Yes,
right?
yes.
Alright, that's a great sharing. I can see how important this collaboration is for the two of you. So my next question is to Belinda. How do behavioral challenges influence a child's daily routine, including mealtime?
So for children on the spectrum, one of their biggest challenges is social communication and interaction difficulties, which means they have a lot of difficulty when it comes to communicating their wants, their needs, their thoughts, their emotions, and this can pose a lot of challenges in their life. So think about a child having to wake up, get ready to go to school, and at school the child has to transition from activities to activities, locations for locations. Not being able to communicate, that would accumulate a lot of toleration, because they would have difficulty sharing that they don't want to do this, or they're difficulty sharing that they don't know how to do this, and it will accumulate. And they also, on top of having difficulty with communication, they also have difficulty with transitions and adjusting to changes, especially unexpected changes throughout their life. So all these together can come together to look like tantrums, meltdowns, escape, refusal, and all this can happen before, during, or even after mealtime.
All right. Okay, thank you. And my next question is to Casandra. So what are some common nutritional concerns you observe in children with special needs?
Based on my observation with children with special needs, I often face many of the children with autism. They often face feeding challenges, such as like very rigid kind of preference, or maybe perhaps they have specific food preference, such as in terms of texture, temperature, or maybe color, or maybe just specific brands. Or perhaps they have like rigid preference in the way that mealtime can only be done or be carried out in a very specific ways. So these are the often common nutritional concern, because all these may lead to the next question, where they might actually have some feeding challenges, such as picky eating, because they only can accept hard food, or maybe they can only accept mixed food when the food and some liquid are mixed together, or so on and so forth. And then every children is different. That's why assessment is very important to be done individually, and then see what is the reason behind it to address all these nutritional issues. Otherwise, it may lead to like nutrition deficiencies, such as low fiber intake, that may then lead to constipation, or maybe low calcium or iron intake, and all these later on may lead to like bloatiness, or maybe some other medical condition that can be a cycle again. Which might be struggling for some parents.
If I may add on, I think what I observe is quite consistent with what Casandra has shared, where it's also consistent with what the study shows us, that there's a prevalence of 70% of children on the spectrums that are picky eaters, and among all these picky eaters, there are 40 to as high as 80% of them having feeding difficulties. So how does it look like? Like when I can share about some of my clients, so I do have some clients who would not eat the whole entire food groups. Like for example, protein, fruits and vegetables. And these are some common food groups that I see that they eliminate completely from their diet. I also have a child that only prefers to eat snacks over meals. So like all the crunchy snacks you can think of, like the chips, biscuits, those he can eat a variety, but when it comes to meal, he's very aversive towards it, which can be an issue because what I see when I observe him is he doesn't feel full. He keeps asking to eat snacks over and over again, and I believe that's right because the snacks is not very substantial and it doesn't lead to satiety. So the child would not feel full, and that would want him, like the child would constantly want to eat. And like often we think about like not having the right nutrition, it's the child would be very skinny. But for my kid's case, it's the opposite. Yeah, that would be a problem, right, Casandra?
Yeah, actually, as what we mentioned just now, every child will be unique. So it could be two different ends. So for example, if let's say the child is focusing on just particular food group, let's just say about carbohydrates, and they avoid any vegetables, maybe fruits as well as protein, whereas focusing on just carbohydrate itself over time, and they don't really limit their food intake, keep asking for more and more, because that they don't know how much is the amount that they should be taking, it will then lead to overweight issue. But on the other hand, like what you mentioned just now, Belinda, like it could be some food that is low in nutrient density. So even though they are eating quite a lot out of it, but because they are low in nutrient density in that sense, so they are actually having struggle with weight gain. So they might put them into underweight kind of situation. So that's why assessment is very important to see for these particular children, what is the nutritional challenges that we can help on with.
True. It's even particularly hard for some clients that have very narrow and restricted food preferences. Like I do have a child that has less than 10 safe food, and on top of that, the safe food basically means the familiar food that the child would eat over and over again and would prefer that. Like on top of having that less than 10 safe food, sometimes the child would refuse to eat even the safe food, like suddenly. Yeah, that happens to my clients before.
Okay. So earlier, Belinda mentioned 70% of autism spectrum children are picky eaters as well. And you mentioned about picky eating. So my question is, how do you assess if picky eating is due to medical, sensory, or behavioral issues?
Okay, so it is very important that we do our nutritional assessment thoroughly. So if let's say it is about medical, so whenever it comes down to assessment, we need to assess any family history and whether there is any recent changes in terms of their diet or any recent changes in terms of their behavior. When if it is come down to medical, perhaps because of over time, recent months that the children has been not having enough fiber coming from fruits or vegetables, and then leading to constipation. Not to mention about children, just like adults. Whenever we have constipation, we feel the bloatiness, which causes us not wanting to eat. So same thing might happen to the children. It might not be because of the behavior, it might not be because of the food that is being served by the parents, not tasty or not attractive enough, but because the children tend to avoid the food because they think that it is this food that causes them to be having the bloatiness. Then we can come down to a conclusion, it might be because of the medical side. And when it comes down to sensory, so the parents or maybe the caregiver might have already noticed that my child specifically only like hard food texture. Or maybe they like this color combination kind of food. So we can know that, or maybe it can be due to the sensory sensitivity, not because they are fussy, but it depends on how the brain process all this sensation.
Mm-hmm.
And then coming down to the behavioral, perhaps like what Belinda mentioned just now, it could be the same food that they have been consistently taking it, considered as a safe food, but one day they just switch it. It could be due to the environment, or maybe maybe the light is not dim enough, maybe the plate has changed, or just the environment, the people surrounding. Then we might be able to conclude that it could be due to the behavioral changes.
So
But
it's not
often-
always about the food.
Yes.
It could be the environment as well.
Yes.
Sorry to interrupt.
No,
but-
no worries. And often it will be a mix of it. So understanding where the challenges come from help us have the intervention.
Yeah, I agree. I think it's really important that we first understand the whys, right, before we think about what to do.
I agree.
Okay, true. So as a behavior analyst, what are the behavioral techniques that's commonly used for children who refuses to eat or has restricted food intake?
In ABA, there are many behavioral techniques that could help to improve eating habits and also reduce the food refusal. It does depend on the client itself, but some of the common ones that would be helpful would be positive reinforcement. So positive reinforcement would be pairing, trying new food with positive experiences. So it could be different depending on the child. For some, it can be as structured as having to reward trying new food with a preferred item or social praises or preferred activity. For some kids, it's just making the whole eating a positive experience. Think about how yummy the food is, how crunchy the food sounds like, and that will be one way. The other behavioral technique that we use often is called shaping. So shaping, maybe some people will call it the food chaining method. So when you think about eating itself is a sensory experience. And a lot of our children on the spectrum, when you look at the diagnostic criteria, hyper and hypo sensitivity to sensory stimuli is one of the characteristics or traits that they have. And when it comes to eating, it's a whole new sensory experience where there's the taste, the smell, the visual of looking how it's being presented, the color, and when you bite it, the texture. So when we look at shaping, we start with something that is easier, where the step one is just touching the food, being okay to touch it. And step two will progress to being okay to smell it. After they're okay with touching and smelling, then we progress to licking, putting it in the mouth and bite. Then we progress to the hardest part, which is combining all of them and chew and swallow. Yeah, so that's one way of looking at it. One other area that we use that will help to support is having visual support, structure, and consistency as well. The reason why visual support, structure, and consistency helps is it really helps to with the predictabilities and help to reduce the anxiety when it comes to eating, because of all the sensory sensitivities that the child has to go through. It's very overwhelming for them, and it leads to high anxiety, and that's why the child will have a lot of behavior trying to escape or avoid. So having visual support, even for some cases that when my child has more advanced language, they're able to understand, they can read, social story really help. So social story is putting out a story to help the kids understand, like, why do we need to eat fruits and vegetables? Why do we need to eat protein? Why do we need to eat dairy? Because it helps you with growing up. And then it also, in the social story, you also put out very clear expectations so that they know what to expect. Having a clear structure means they know when the mealtime is going to come and when the mealtime is going to end, right? So they know that, okay, so play is going to wait, I go to eat, but it is also going to end and I can go back to play. So having that structure would really help. What else on top of that? this one is not really a behavior strategy, but it's just advice in general, is careful planning. Yeah, so when we do an intervention, we don't just pluck it and do it. We actually plan how to do it, almost like a lesson plan. We have a lesson plan, then we try it out. Yeah, so I hope that helped.
Yeah.
Okay, so just a recap on what are the strategies that you mentioned.
Yeah.
Visual support, which also includes of social story.
Yeah.
Positive reinforcement, shaping or food training, as well as careful planning.
Yeah.
Right. Okay. Thank you so much, Belinda.
No worries.
All right. And my next question is to both of you, what are the common challenges that you see in changing eating behaviors in children with special needs?
Oh, maybe I can go first.
Yeah, sure.
Yeah, so when I introduce some intervention or strategies related to eating, usually it's the initial phase is met with resistance. Yeah. And then what I commonly see is also when I do the shaping or the food chaining method. Step 1 and step 2, they progress a little bit faster, so they are more okay to play with it, to touch it, or to be involved in the food prepping. But when progressing to licking, biting, and chewing, it will take longer time. Yeah. What
Agree
about
with
you?
If let's say, I wouldn't call it much of a challenges because sometimes it could be fun that way because it is kind of difficult for us to get some children with autism. They might actually have very, very strong, rigid in terms of their preference. So even like maybe like what you mentioned about the safe food, changing the food shape itself, or maybe adding some color into it, or maybe adding one small potato or maybe carrot would be a refusal to the children to not have it already. So it's kind of challenging, at the same time fun, because it helps us to think of any other alternative way to try to overcome that. So it takes a lot of patience and consistency in trying different methods just to get the same goal done. So this whole journey, I would say, is going to take time, and then it might be a challenges for the parents because sometimes, like what you mentioned, we have to start with like smell first, and then touching, and then seeing and all, and then often parents might find it kind of time consuming. Why is my child not getting there? Is he or she not progressing well or something like that? So we have to make sure that communication is done and reassurance is done as well, just so parents can build trust and then knowing what we are doing and all.
That's true. And I just a quick drop into what you mentioned earlier, where it's like getting them to not have too high expectation, but manage the expectation because this will take time. Behavior doesn't change overnight. And also, you just reminded me of a study that they were trying to measure like what is the average time that the food needs to be exposed before the kid is able to accept it. On average, it's between 10 to 15. Yeah, that's how many times that we need to expose before the expectation that the child needs to eat it and swallow it.
All right, okay. So how do you handle resistance from either the child or the parent, caregivers as well, when implementing dietary or behavioral interventions or strategies? So you may have resistance from the child as well as families. So how do you deal with those?
If let's say with the child, I would say that is where the collaboration comes in very helpful, because sometimes we as dietitian or maybe even parents itself, we can't really understand what is the needs, because most of the children with autism, they don't really express well what is their want and also what is their needs. So from there will be a gap where we can't really understand. We can only merely guess it and maybe throughout a lot of try and error trying to understand. But if let's say the parents manage to engage like ABA therapists, then they will be able to help shape the communication, and then we can better understand the child as a whole. And then from there, if let's say there's any resistance coming from the child, we get to understand the why behind it, and then we can get to the point more easier. Understanding that it could be due to the behavioral factor, or maybe due to the sensory touch or something like that. But if let's say coming from the parents, often the resistance, I would say, based on our experience, would be about parents thinking that this method doesn't work. So they have really tried this method for once or twice. They don't think that it's gonna work, but they don't understand, or they think that once or twice is enough in terms of trying. So they resist to actually continue trying the same method, but often it is not the case, because like what Belinda mentioned, even trying the same food, same way every day, in order to be established as a safe food, it might actually take about just at least 10 to 15 times. So often there will be a misconception from the parents that tried this once or twice, it doesn't work, so we need to move on.
When I work with my parents, right, I did experience their resistance from the child or from the parents as well. So what I find really helpful is to just be really compassionate and also flexible. So when I experience resistance from the parents, I just go back to fully understand that as much as it's overwhelming for the child, it's actually very overwhelming for the parents as well, because they are the one going through it together with the child every single day. And when we work with the kids, we always think about, okay, how to build trust with the child, how to make it a more positive experience. We do a lot of positive reinforcement, but we often neglect the parents. Like the parents also need to be positively reinforced. Like I remember having a parent spending times every single night thinking about or stressing about like what are other ways that I can prepare the food, or what are other food I can buy, or just keep spending a lot of time, and she feel very defeated when in the end the child doesn't try. But then when we look at it, maybe she tried 10 different ways of prepping the food, but actually the child does accept one of it, and I would highlight to the parent that one of it actually works, and this is the small win that we should celebrate. When we look at behavior, we don't want to look at big changes. We want to look at tiny, small changes and work on consistently improving that tiny changes.
I'm sure parents do want the best for the kids, but maybe they don't have the knowledge on what exactly to do, right? So that's where all of you can come into.
The support and the parent trainings from both ABA and dietitians would definitely help.
Just so we are speaking the same language towards the same goal.
Yes. So since we are talking about parents, right, the next few set of questions are going to be on parents' involvement and educating them. So would you like to share some red flags that you would like parents to take note on? It could be regarding nutrition or behavior interventions as well. Like any red flags that they should take note on?
For my side, probably the biggest, the more obvious one would be behavior challenges surrounding meal times. Right? So it could be escape, it could be difficult sitting at the table, not able to communicate that they don't want or why they don't want. That's definitely an area, that's definitely one of the red flags. What about you?
To me, in terms of nutrition or health, if let's say, when does the parent need to come to us to get assessment done and all, I would say if you notice that your child is very restrictive in terms of food, like for example, you notice that your child only eat a specific food group, for example, carbohydrates, protein only, or maybe food that is high in fats only, that is also one of the red flags. If let's say they are not just restrictive in terms of the food groups, perhaps throughout some time you notice that they only comes down to eating 10 different foods. They refuse to actually accept any new food, or perhaps regardless how you're going to prepare the food or whatsoever, their weight gain is not there, or they gain weight excessively. That is also the moment where you can actually get a dietitian, get a proper assessment to see whether there is any nutritional help needed.
I think on top of that, right, is like when I do decide that it is a goal that we want to intervene in, I think dietitians will probably be very good at identifying what food group that we should work on. Like, let's say if our child and avoid fruits and vegetable, protein and dairy, all three of them, which one should we start working on? Or is it a combination of all? Or as we know that working with children, when it comes to accepting new food, it will take time, but in the meantime we still need to find ways to make sure that they meet their nutrition deficiency. Then what supplements would be good, right? That is definitely something that, Casandra, I will need your help in deciding for my children, and advise the parents that the parents of the families that I'm working with.
So as same likewise. So actually, basically, if let's say the feeding challenges is not too much about the sensory touching or sensory sensitivity, it could be because of the behavioral factors that we mentioned just now. That is also when
not willing to be cooperative.
Yes. Even though the nutrient-dense food is being served, but the child is still not taking. Is there any way that we can communicate with the child or maybe with the parents to get the same idea implemented? That is also when ABA therapies come in very helpful.
That's true.
All right, okay. So just a quick recap again on some red flags that Casandra mentioned: avoiding a specific food group, excessive weight gain, as well as no weight gain, right? These are some red flags that you mentioned. All right, okay. Next is, what are some tips that you would like to offer to parents who are specifically struggling with mealtime and nutrition issues?
There are so many tips that I want to share. I think a good start with a lot of families, that when we first have the initial conversation, I always try to share the 5 steps. This is the tips that I got from the conference that I attended a couple of years ago. So the 5 steps, it starts with step 1. You want to create a food log. So creating a food log, it helps you to understand your child better. So because from the food log, you can identify what does the child currently likes to eat, what does the child currently can accept, versus what are the food that you try and the child consistently reject. So that's step number 1. Step number 2 is you want to analyze the food log. So now you collected enough information, you want to analyze it. Like, you want to see all the food that your child is willing to eat, can accept. Do they have a pattern? Like what Casandra answered. Is it a specific texture? Is it a specific color? Is it a specific food group? Or is it even from a specific restaurant? I remember I had a child who he would eat different food groups, but only from Nando's. I remember that there's this Mediterranean fried rice that he likes to eat. So the mom's like, oh great, he'll eat vegetable, he'll eat carbs, and there's even meat because there's the grilled chicken or the baked chicken from the Nando's. And when the mom tried to create the same food, the child rejects it. But when the mom ordered for Nando's, then he's okay. So then identify the pattern would really help you to understand your child better. Step 3 is to create a hierarchy of the food. So like, once you collect data, you start from like all the safe food that the child is already eating, until the child that sometimes accepts, sometimes don't accept, to the ones that the child completely rejects, 0 success rate. After you're creating the hierarchy of the list, you now are able to introduce the food slowly and in small quantity. So when we talk about introducing the new food in slow and small quantity, we don't start with introducing new food yet. In fact, we work on the safe food first. So this is because we identified that for our children, in the safe food, sometimes they are not flexible towards it. So I think you mentioned just now, like it is the same food, but when it's presented in a different ways, then the child will reject it. So I do have similar case where when I observe the child, like he is able to eat French fries and he loves this French fries from McDonald's, but when it is removed from the packaging and placed on a trap, he would reject it. Or if the mom tried to make her own French fries because it's healthier, right? Less oil and better nutrition, the child will also reject it. So we recommend working on a safe food and try it in different presentations. So for example, if the child likes to eat cheese slices, can you cut the cheese slices into different shapes? In apple, into a heart shape, to star, and the child can still eat it. Or it could be working on eating the cheese slices but pair with different foods, so cheese with fruits, cheese with sandwich, or same cheese but you melt it, or it's like eating cheese but different bread. Okay, so the gist is that you want to start with the state food but present it in more flexible manner. Then only you start working on this new food. So I mentioned 1, 2, 3, 4, and the last one is you want to assess whether or not it's working. So even if it looks like it's not working, you look at the mini changes, that's okay. But if it's absolutely not working, you don't want to persist with that same method. You want to look into trying something else.
All right, okay. So the 5 steps are: first, food log, current intake. You got to look into the current intake and what are they avoiding. Then next would be analyze the pattern of. And the third is create a hierarchy.
Yes.
And the fourth would be start small and slow.
Yes.
Yeah. And the fifth one is assess. If it's working, then reevaluate.
Yes. Exactly.
All right.
If I may add on to Belinda's point of view in terms of the tips that we can share to parents. So in terms of meal times, it would be better if the parents are less stressed, because parents' job is to basically offer balanced options, and we must accept the fact that even us, everyone, will be having our own certain food preference. For example, I have to admit, maybe me myself, I don't eat much of brinjal or maybe capsicum and all. So we can't really expect a child to be able to accept all kind of texture or maybe all different foods and so on and so forth. So we have really done our job as a parents to offer the balanced options, and we have to respect the child that it is up to them to decide what and how much to eat. But of course, we don't just let go if the child is not getting enough nutrients, we just let it be. That is why we are here to often help. So we help in a way that even though the child is comfortable with the safe food, but we try to use different methods to add on, making sure that the child is still growing and also achieving the nutrients needs and all.
I like when you mentioned that the child gets to decide what to eat and how much to eat. So I do think it's really important to balance between respecting the child's autonomy, but also making sure that the child is able to get access, right? Access to a balanced nutrition.
And the parents might be acting as a role model and don't set unrealistic kind of goal to himself or herself. Because sometimes if let's say we are eating a food, like a variety of food, just in front of a child, even if the child doesn't really eat it, we don't actually introduce it directly, but the child learns. So if let's say the child sees that parents are eating a variety of food, it might actually increase the chances that they are more acceptable in the future when you are introducing the same food again. So we don't have to, like what Belinda's mentioned just now, straight away the next day they have to immediately accept that food that we are introducing, but it is gonna take time.
I think modeling is a great way. We also get our parents and therapists to model not just eating, but also language and communication. That's one way that we teach our kids as well.
All right. So from this discussion, it's obvious that parent involvement is very, very important. So how do you involve parents in your interventions when you plan?
So usually when, just now we mentioned that our plan starts from assessment, going down to diagnosis, intervention, and finally monitoring and evaluation. So parents need to understand that, not only parents, but any caregiver. So they need to understand that they are the central to the process. So basically starting from the assessment, we need their input a lot. For example, because they are the one that deals with the child at all time, they are the one that give full support to them every single day. Even though we are there to support, like Belinda's therapies or maybe a dietitian, there's just so limited time that we can spend with the child. So having parents' involvement in the assessment is very important, just so they can tell us what they observe, what they learn about the children. And then when it comes down to what we can offer in terms of intervention, we also often need parents' involvement. Because like during the intervention time, we can only be there for a few hours, let's just say. And then we need to make sure that the method is reinforced, not only when we were there, but also in the morning or maybe at night. So parents' involvement in the whole intervention plan, starting from assessment all the way to monitoring, is very important to us.
I think what Casandra shared is really, really insightful, that when we do therapy with our children, it's only a couple of hours. So, but out of the other 3 hours, let's say our intervention is typically 3 hours at one go, the food is not, you don't just eat during that 3 hours. You eat throughout the whole day. There's breakfast, there's lunch, there's dinner, there's supper, there's tea time, there's snacks. And what happens to these meal times that being addressed is out of the intervention. But one thing that on top of just emphasizing that parents needs to be involved, is that we do our duty job to also help them. Because they might feel like they don't know what to do, and that's when we can help them. So like for example, in our interventions, usually the therapist will try to take videos, will try to write session notes to tell the parents that like, this is the new food that he's trying, and today he finally licked it. And then the parents can go on and like introduce it during their other meal times as well. And then what we recommend for parents to do is that they also take video of themselves or take notes, so that we can help them if they are running into difficult situations, or like we can help to give corrective feedbacks and on what they can change in order to make the eating time more pleasant or more effective.
That could actually also help with creating a positive meal.
Mealtime
kind of experience.
And also give us a chance to provide positive reinforcement to the parents as well.
True.
All right, that's great. Next is on common misconceptions. So what are the common misconceptions parents or caregivers have about your respective fields?
For ABA, the common ones that I hear from parents, or maybe not just parents, but for the public itself, is ABA is rigid. So a good quality ABA, it shouldn't be rigid. It should be flexible. It should be very much focused on strength, the child's strength, tailored towards that. And also, there's a lot of positive reinforcement, building trust, building a good rapport. On the other one that the public, I think this is really important to mention, and I'm glad I have the opportunity to do so, is that ABA therapy is not meant to fix a child. It's not meant to normalize them, to make them similar to typical children. It should be tailored to understanding what is that child's strength, what is that child's goals, and provide him the opportunity to learn all these goals so that he can have a high quality life.
So in terms of misconception with dietitian, often parents would think that everything else can be Googled. So if let's say my child has this issue and this is what I notice in terms of the signs and symptoms, I can just Google it and then just apply whatever that is appearing online to my children. They have this misconception that one nutrition plan fits all. So if let's say my child and someone else's child is having more or less the same diagnosis, same issue, whatever that may work for that child could be working for my child as well. So one of, in terms of the autism services and all that we have been providing, so far one of the most common diet that is applicable to children with autism is about a gluten-free or casein-free diet. So yes, it might be helpful for those children that is diagnosed with having this specific diet plan that is required to be implemented throughout their daily routine and all. But if let's say your child is not having that issue, they don't actually need to go on with gluten-free and casein-free diet, because if let's say there's no need for that, but the parents still somehow apply it, it may actually lead to something more serious, for example, protein deficiency, or maybe other micronutrient deficiency, that the original problem is not there, but because of this misconception, it has becomes another nutritional issue. So with that, we are here to help to differentiate or help you to filter what is right and what is wrong, just so the parents know what to do. And that is also why our assessment and diagnosis as well as intervention has to be done individually, and a personalized plan has to be implemented, because every children is different.
I agree.
All right. So my next question is about interdisciplinary team. How do you see the role of interdisciplinary team involving in early intervention? Do you think it's important?
Yes, very important. Yeah. But I do see a more awareness on the importance of different experts coming together to join forces and work together to support our children, our neurodivergent children. I see the changes. When I first started, it was a lot of like, I do my own thing, and then speech therapists will do their own thing, and then dietitian will do their own things. And now it's a lot more of like, oh, can we like have access to each other's reports? Can we have a Google meeting together to, I want to understand what you are doing in your APA sessions, and then vice versa, the ABA therapist will want to know like, how are you doing in your OT sessions, so on. So yes.
In my opinion, in terms of early intervention, like having those different healthcare professionals working together, that's also very important. Because imagine us being a patient itself. So if let's say I need to listen to doctor, I need to schedule an appointment with doctor, and then doctor tell me this, but when I schedule appointment with therapists tell me otherwise, and then whenever dietitian asks me, I need to repeat the whole story again to them. So as a patient, I will be very frustrated, because why can't they just communicate among themselves? And then sometimes whatever that I perceive, like doctor say this, but when I convey the same message that I think I understand to another healthcare professional, it may be different. So with that, those healthcare professionals, even though they have the same goal as in helping me to improve, but the goal might not be achievable because they are working independently.
They're not aligned.
Yeah, they don't speak the same language per se. Yeah.
And the child is still very confused.
Yeah, and then mommy tells me otherwise.
So you mean the information may not be accurate across the professions?
Yeah, it might not be in sync. Just like if let's say a child in a household family, when they wanted to go out and play, but mom says this, you can go, but dad says otherwise, then the child will be confusing as well. So same goes to the parents. If let's say different healthcare professional, it's not that they don't engage each of them, but because each of them work independently, so the parents would be somewhat confused, because different of the professional says differently, and then whether this week my goal is to follow doctor, or this week the goal is to follow this, and so on and so forth. So it would be much better if all of us can sit together and then have that in-depth discussion just so everyone is clear, and then we have the same goal to work on during this specific period of time.
Yeah. I think you're right. It's definitely like all different parties, all different experts, all different experts and all the people that's involved in the child's life work together. They are more consistent, less miscommunication, less confusion to different side, and then the goals are aligned, right? Not everyone like working on different phases, like even the same goal, like I'm working on step 1, but you're aiming to step 10, which is the hardest one.
And actually it is not just happening to parents, it goes the same to the healthcare professional as well. Because to be honest, if let's say I just play around with different food variety, introducing different food at some point to the parents and also to the child, but if we dietitian never understand what the child wants or what the child needs, we will never be there. Maybe not so soon, we will eventually get there, but it has to go through a lot of trial and error. But if we manage to collaborate earlier, then you can work on, like Belinda, you can work on the part where they get to express, and then we get to understand, and so on and so forth.
True. And also, like for example, the therapist has more hours working with the children, so they've already built a better rapport, right? And then and there's already trust over there. Then it's easier to add on, right?
All right. Okay. So, what's one change you would like to see in how children's feeding and behavior challenges are addressed in school or clinics?
Definitely be compassionate and manage your expectations, and don't jump into force feeding. So don't just try. Why can't you just try? It's just one bite. Just try and then you'll be okay. Try and then it's yummy one. I think just that's one thing I can think of.
If let's say in terms of school or clinic setting, I would say maybe we need to create more of a better awareness, not only like to parents understanding the child, but more like public, or maybe the preschoolers, friends, or maybe adults, how they perceive or how they understand about children with autism, because they might sometimes being perceived as someone who is fussy. They are just basically picky in terms of eating and all.
Like they purposely don't want.
Yes.
Right?
So they don't really understand that it could be due to the behavior changes or needs that needs to be adjusted. They need to be specific in their environment, their environment that they deem to be safe, or maybe it could be due to the emotional side, or it could be due to the sensory sensitivity. It's not because they wanted to be picky in that sense, but it depends on how their brain actually process all these sensations. But people don't understand, so they just kind of label them as you are fussy. It could be just one bite, just take it. Why are you like so picky or something?
Why are you so stubborn? That's the word that I do tend to hear.
So I hope that in terms of improvement in maybe school setting or maybe like clinic setting, that we can do is create more awareness, just so more and more people understand this medical condition, and also trying to create a more supportive kind of environment for them, not only at home but also when they're out there.
The community setting, all the environment that they are typically exposed to.
Because we can't keep them at home 24/7. They still need to be out one day and make friends, mingle around.
All right, okay. So my last question to the two of you, what's the plan? How are you guys planning to collaborate and support our children?
I'm just thinking, right, when I start working with a family, we usually start with assessment. And then if during the assessment, right, feeding is an area that the child will need more support on, I think straight away we need to warrant an assessment from dietitian also. And then when let's say if I start with the assessment first, then I refer to you. When you already have access to my assessment as well, so that it's not so much of like, okay, I do it and you also did it, or like, oh, you didn't do it. So at least there's start from there. And then after we have the assessment would be when we're setting goal. Maybe that's when we need to set the same goal, and then the strategies that we will try. Like let's say for me, usually after we look through the strengths and the areas of support, we'll come up with an intervention plan, right? But we shouldn't immediately use that information plan. We should meet together to see if that's the right way to do it, because I'm sure dietitian have the input and vice versa. And only after we have the input from dietitian and also agreement from the family, then we start doing it. And then every time we do it, there's also updates that both sides can access to.
I think it would be a very exciting collaboration, like what Belinda shared just now. We will do our assessment and then we share that piece of information so that we are coming into the same page, and then we speak the same language before we even carry out the intervention. And I'm also very much looking forward to the intervention part, because that is where the food comes in and also the behavioral change comes in. How we can actually carry out the same goal but with different methods. Because perhaps maybe for us, we are more specialized in changing food texture, the temperature, playing around with under the same food group carbohydrate. If potato doesn't work, then we try rice. Rice doesn't work, we try spaghetti. So all these we can be specialized in, but using different way where the child can understand and can accept might be your expertise.
So on our side, I can support you by creating visual support so that the child knows, are clear what's going to come. And we can work on like, our therapists are very creative. They're very good at playing, so they can make the mealtime experience really, really pleasant and positive. And then we do a lot of positive reinforcement, so we know exactly what to positively reinforce with, because we know what's the kid reinforced with.
As the parents' point of view, I think they will be able to adapt our combined way of method, and then to whenever we are not there, they can still apply it throughout the day, which is kind of interesting, I guess.
It will be. I'm so excited.
I'm excited too. So thank you so much for your insightful sharing. And I hope to see Seed Autism Services and MyDietitianEats collaborate more frequently. And I'm sure parents are also equally excited. And once again, thank you so much for your time.
Thank you.
Thank you.